Hello, my name is Jose Miranda Velasquez. This video is for BSN 225-04, the oral medication administration video. I'm in my 9-year scrub. You can see my badge. I'm going to start off by verifying the doctor's orders for this patient. Then I'm going to verify the 6 rights of medication administration. They are the right patient, the right medication, the right dose, the right route, the right time, and then the right documentation. After those 6, I would check my medications ordered within the MAR. I need to verify this 3 different times before I can administer any medication to any patient. This here's the first step in doing so. For this for this patient, there are 5 medications ordered that are found within MAR 1. They're daily 9 a.m. medications. The first is Doxycycline sodium. It's a 100 milligram tablet. The second is warfarin. That is a 5 milligram tablet. The third is furosemide. That is a 20 milligram tablet. The fourth is potassium chloride, a 20 milliequivalent tablet. The fifth is a liquid medication. That is acetaminophen, 500 milligrams per 15 milliliters. There are no dosage calculations needed for these medications. They are prepped and ready to go. I'll grab them and head towards our patient's room. Once there, I'll knock, walk in, enter, and close the door behind me to ensure patient privacy and to avoid any HIPAA violations. Put my supplies on a clean, flat, dry surface. Perform hand hygiene and introduce myself to the patient. Hello, my name is Jose. I'm one of the nurses here. Can I have you please state your name, your date of birth, and medical record number if you know it? At the same time, verify that information with the patient's wristband. That counts as 2 patient identifiers. Okay, Mr. Miranda, thank you. Do you have any allergies by chance? No, thank you. Okay, let me get situated. Allow me to look on my computer really quick, and I will be with you in just a moment. This would be my second time verifying the medications within the MAR. Then I would go ahead and perform hand hygiene again. Go ahead and put my gloves on, and we're going to go ahead and get started. Now that I am at the patient's bedside, I'm going to verify the medications a third and final time within the MAR. Before administering my medications, I need to make sure there are no pre-administration assessments needed. If they are needed, for Doxycycline sodium, I need to make sure they're not experiencing any vomiting or diarrhea. For warfarin, I need to make sure they're not showing any signs of excessive bleeding or bruising. No blood in their urine or stool, or any cuts that will not clot or stop bleeding. I want to monitor their lab values for PT and INR and make sure that they are staying within normal range. For the third medication, for furosemide, I want to check their blood pressure, the pulse, and their weight. For the fourth medication, the potassium chloride, I need to check their blood pressure, their pulse, and possibly obtain an EKG depending on the situation. On the fifth medication, the acetaminophen, I want to make sure they don't have any liver complications. If they do, I need to check their mouth and monitor their liver functions through testing to ensure they are within normal range. It's not very common, but with diabetic patients, check their glucose before giving the acetaminophen, as it can cause slow false readings. Now that I'm done with all of those, I'm going to move on with my patient. Okay, Mr. Miranda, I have your medications here. They are daily 9 a.m. medications. I have 4 tablets and 1 liquid medication. Allow me to tell you what they are and some side effects and adverse reactions. So from there, I would explain for some side effects. It's typical to get them with most medications. We don't want it to happen. And if so, we don't want the side effect to prolong and get worse. If it happens, please let me know. For the adverse reactions for any medication, they do require immediate attention. We don't want or expect it to happen, but if they do, I will notify the doctor. So for the 4 tablets, for the first one, it's Doxycycline sodium. The medication is a stool softener, is given to prevent constipation. Some side effects for this would be abdominal cramping. You may experience some nausea. Some adverse reactions may be some facial swelling or rashes along the body, anywhere on the body. So for the second medication is warfarin. This medication is an anticoagulant, which is given to prevent blood clots. Some side effects would be if you have any cuts or wounds on the body, they will take longer to clot or heal. When you brush your teeth, you may experience or notice some bleeding. Brush a little softer, or purchase a softer toothbrush. Some adverse reactions for this medication would be coughing up blood, as well as some blood in your stool or your urine. The third medication is furosemide. The medication is a diuretic, which helps get the body rid of excess fluid. It may lower your blood pressure. Some common side effects are increased thirst and maybe a slight headache. Some adverse reactions would be muscle cramping, weakness, which sometimes signifies an electrolyte imbalance, so please notify me if any of that occurs. For the fourth medication is potassium chloride. That is a supplement to ensure that the potassium levels do not drop down low. Some side effects are you may feel a little gassy, possibly an upset stomach. Some side effects would be nausea, some slight loss of appetite. For adverse reactions, it would be rash on the body or extreme abdominal pain. Any of these adverse reactions occur, please let me know. Mr. Miranda, do you have any questions for me? No? Perfect. Allow me to get your tablets ready. First thing, I'm going to seat you up a little bit more so you're comfortable in bed. You comfortable? Okay, good. For the tablets, do you want to take them one by one or all together? Perfect. I'm going to give you all 4. Okay, I'm going to place a medicine cup right here in front of you. Okay, here are your 4 tablets. Here's some water. Go ahead and take those. Okay, perfect. For the liquid medication, give me a second to prepare it. Excuse me. For the liquid medication, I need to make sure that I shake the medication for an appropriate amount of time. I want to make sure that the label's in the palm of my hand so I can protect it, and I will remove the lid and allow the lid to sit upward. When I begin to pour the medication, I need to ensure that it is on a flat surface and pour all the way to 15 milliliters. I need to ensure that nothing touches the rim of the cup, and when I'm done pouring, with a clean tissue, wipe the edge of the rim and not the top. Once I'm done, I will dispose of it and put the lid back on. And I'll place the bottle to the side. Grab my tissue, clean the edge, not the top, just the edge. Grab my lid, place that back on top, place it to the side. Okay, Mr. Miranda, I have your liquid medication. Are you ready to take it? Mr. Miranda, There you go. Sorry, make adjustments to my camera here. Okay, Mr. Miranda, here's some water. How are you feeling? Are you okay? Okay. I'm going to have you remain upright for a little bit. I will come back and check on you, okay? Are you comfortable? Okay. My patient stated that he is comfortable. The bed is in proper position and the call is within reach. At this point, I will remove my gloves, dispose of them. Perform hand hygiene. Take my medication, liquid medication, take it back to the med room and document my results. Thank you.